I get asked a lot about functional dentistry. What is it? Functional dentistry might not be a term you've heard, but it is essentially the same thing as functional medicine, but in the dental world. What that basically is root cause medicine, looking for the main cause or the underlying causes of what's causing some sort of ailment or imbalance. Functional medicine is all about restoring balance and function to the system. And when I say system, I mean the body. What does that mean for oral health? Instead of just saying, oh, you have a cavity, or oh, you have gum disease, it's looking at why. Is there some sort of gut dysbiosis? Is there some sort of oral dysbiosis, meaning an imbalance of the microbiome of your mouth or your gut? Is it something to do with hygiene? Is it something to do with what you're eating? Is it nutrient deficiencies? Are you unable to absorb the nutrients? How are your cells working on a much deeper level in order to utilize these nutrients to detoxify, in order to properly create balance within the system? These are some of the things that functional medicine and specifically functional dentistry in the examples I'm giving you focus on. If you have any questions about functional dentistry, please feel free to reach out and look below to make an appointment with me today. I'm not going to lecture you about flossing, but what I am going to do is answer why I say to floss before you brush. Just think about this. Obviously, the toothbrush doesn't get in between your teeth, and you can't clean thoroughly by just brushing. That's why we need to floss. But my idea is to floss first, because you loosen everything that's in between the teeth, you get all that out, and you get all the debris loose in there, and then brushing your teeth, so then you can get all of the rest of that out, and it's not just sitting in your mouth. Because if you brush first and then floss, you're gonna have all this other debris sitting in your mouth.
Oh, doctor, I can just rinse after I brush. No big deal.
But if you're using the hydroxyapatite toothpaste, we don't want you rinsing afterwards, because I want the hydroxyapatite sitting on your teeth. That's why you floss before you brush. How to properly brush your teeth. You want to make sure you're using a soft bristle toothbrush, and you're just going in circles and not holding it like a sword, just with 3 fingers, just gently brushing your teeth. If you're brushing and you're flossing, you shouldn't need to do it hard at all. If you're using an electric toothbrush, you do the same thing. 3 fingers, just like you're painting your teeth. Clean your tongue after you brush your teeth. Very gently, because most of the bacteria hangs out, guess where? In our mouths. That's right, on our tongue. So you want to make sure you clean your tongue every single day. We got brushing our teeth and our tongue. You want to make sure you're using hydroxyapatite toothpaste versus fluoridated toothpaste. Hydroxyapatite is actually shown in studies to remineralize, strengthen teeth better than fluoride. And it's safer. There's no downside to it. It's a natural compound found in our bodies that makes our teeth and bones hard. Why not utilize it every day? And the other trick is, don't rinse afterwards. Just spit and let that sit on your teeth. Oil pulling. This is one of my favorite oral microbiome balancing therapies that's practically free, that I suggest people do about 2 to 3 times a week. That's what I do, because I find if I do it more, it can even irritate my gums a little bit. Use a really high quality coconut oil. That's organic, unrefined, cold pressed. And all you do is take a teaspoon of that. You can do this before or after brushing. Teaspoon, put it in your mouth, and you swish. Get it all over your mouth, all the different areas in between your teeth, and all that. And then you do this for anywhere, at least 5 minutes. I recommend 5 to 15 minutes. The closer you can get to 15, the better. That might sound like an eternity, but you can do other things while you do this. You can do this while you're doing laundry. You can do this while you're doing the dishes. You can do this while you're gardening. You can do this while you're watching TV. There's so many things that you can do to multitask, and this is really beneficial for balancing the oral microbiome. The one other tip I will say is do not spit it down the drain. Spit it into the tissue or the garbage, because that can clog your drains. Did you know that good health starts with a healthy mouth? I know there are a lot of people out there that have gum disease and cavities, and they're doing all the right things, but they're still getting gum disease and they're still getting cavities. What you need to do is get a comprehensive understanding of what's going on with your oral microbiome, which also affects the gut microbiome. We need to see what's going on a deeper level. We all have a different makeup of the microbiome compared to other people. It's kind of like a fingerprint. It's just different. This is how you can solve that problem, because we can find out what is going on uniquely with you. What this does, it allows us to get a more comprehensive understanding of our unique microbiomes, specifically of the mouth, but it actually does also test for markers in the gut microbiome for inflammation. This will give you a better understanding of what's actually going on in your mouth with the things that you can't see. It's one of the simplest things you can do. You open the kit, it has very self-explanatory instructions on here. It comes with 2 of these little vials, one in case you mess up, but all you really need to do is spit in this little vial, seal the cap back on, and then you ship this back out to Bristle, and they'll give you your results in about 2 weeks. Do you want to win this? I'm really happy to announce that I am partnering with Bristle. There are going to be 2 lucky winners to win 1 oral microbiome testing kit and 1 oral health probiotic bottle. I like Bristle. There's a lot of reasons why I like Bristle, but number 1, it's very easy to do, and they have a very user-friendly interface online. You can actually work with your provider, and you can go over your test results with the provider. The other thing that I really like, they look at all of the microbes in your mouth, not just a select few that are known to cause certain diseases, certain pathogens. Follow the instructions below in the caption, and you'll find out the ways for you to win your free test kit and oral probiotic. Hydration is really, really important. When we think about hydration, yes, it hydrates our body, all the chemical reactions in our body is 70% water, all of that's really, really important. But also, what a lot of people don't realize is that dry mouth is one of the biggest cause for cavities. Now, you could have dry mouth for plenty of reasons, but hydration is a big one. And hydration isn't just the amount of water that you drink, it's the quality of the water you drink, the minerals in the water. That's what hydrates our cells. Make sure you're drinking properly mineralized water. This thing may look funny, but it's really not, because this is a gas mask. And this is one of the pieces, one of the tools that we utilize when it comes to removing mercury amalgam fillings, utilizing the SMART technique. Safe mercury amalgam removal technique. And this is the method that was created by the International Academy of Oral Medicine and Toxicology, the IAOMT, to safely remove mercury amalgam fillings. The 2 most dangerous times to be exposed to mercury vapor, because you can inhale it and you can't see it, is when they're being placed and when they're being removed. Recommendations: don't have them placed and only have them removed utilizing the SMART technique. 3 of the main things you have to look for, this isn't all of the things when it comes to the SMART technique, but 3 of the main things is that the staff is protecting ourselves, because that's really important, because everybody has a specialized mask when we're removing the mercury amalgam fillings, as well as having proper ventilation in the room. We have to have specialized air scrubbers just for this, in addition to the high-speed suction that we utilize on all of our patients. And then also, we have patients on oxygen the entire time, and also fully covered. It's really important that the patient's breathing oxygen, we're breathing safe air, and that the room is being ventilated properly when you're having mercury amalgams removed. Let's talk about root canals. I'm going to draw a tooth for you. There's a lot of reasons why I don't suggest root canals, but I understand some people do need them for certain circumstances. However, if you can avoid them, prevention is the best way. But if you want to understand why I don't prefer root canals over removing a dead tooth or removing a permanently unrestorable tooth, is because we don't have the proper instrumentation to completely 100% sterilize the inside of the tooth with the instruments that we have currently. I'm going to show you why. When we do the root canal, pretend this is the back side of the tooth. So they'll go in the back side, they'll make a hole here, they'll go into the nerve canal here, and then this is where the nerve is. And I just drew a few little channels here, but what you don't see, so this is the nerve and it branches off here in different areas into accessory canals. But what you don't see, in the root of the teeth, there are hundreds of thousands of little microtubules that go right to the nerve. So when you need a root canal, all of those channels that are connected, we cannot instrument. Now, with a lot of the tools we have today, some of these bigger canals, we might be able to clean out thoroughly. Some bacteria is going to be left over in this tooth, and this is why the root canal can get reinfected and you can get an abscess down here in the jawbone. Like I said, the reason why I'm not a big fan of root canals is because I see all the time people coming in with failed root canal treatments, and they come in with these new abscesses. And even conventional research shows that redoing a root canal for a second or even third time has a much lower success rate than doing it for the first time. I don't generally recommend root canals unless someone wants one, but I always present these different options for people because that's my job, to let you know what the options are to serve you best. Do you know what this is? This is what a dental implant looks like. This is the implant part. But did you know how many parts there are to an implant? There's actually 3 parts. And this is the part that actually goes in the bone. Then there's another part that attaches to this called an abutment. It goes on like that. So this is like as if you had a full tooth. But there's one more piece. There's a crown that goes on top of it. And now you have a full tooth. If you were wondering what the alternative is when you have to have a tooth removed, or if you're going to remove a failed root canal, implants are the best option. And this is what it looks like outside the mouth. Any surgery that's ever done in dentistry, you should ask to have PRP or PRF used because it helps with healing time. Not only do you heal faster, but it is more comfortable. What that term basically means is platelet-rich plasma or platelet-rich fracture. So how do we do that? We draw a little bit of blood in the office the same day as the surgery. Then what we do is we take these vials of blood, anywhere from 2 to 6 of them, and we bring them over here to the centrifuge. Put them in the centrifuge, and this will spin at a very high speed. And then in the vial, we have the blood separated out into 3 different sections. And what this does, it concentrates your healing cells, your immune cells, the really important cells in your body for healing, into the middle section. And we can draw that up or use it as a membrane and put that on the surgical site to help you heal. If you have tension in the muscles in your jaw, if you have tension in your neck, tension in the upper back, if you get headaches, if you have clicking in your jaw, popping in your jaw, kind of like a grinding sensation in your jaw, all of these things are TMJ dysfunction. And these can cause many, many problems down the road. But what it also does is it causes trauma to the joint here. And it can actually reshape the bone that fits from the lower jaw into the upper jaw. What I'm doing is something called myoaligner. If you're familiar with orthotics for shoes, this is kind of like orthotics for your jaw. What this does, before I show it to you, is it actually finds the correct position using a TENS unit machine that is specialized to send proper frequencies to the nerves in our face and the joint here to help relax muscles. So we find the proper jaw position and bite for your specific joint. We align the maxilla and mandible properly, relaxing all the muscles around the joint to find your correct bite. Once we've found the proper bite and we've removed the pathological position of the jaw, then we design these special types of orthotics that are customized to you. And these can come on and off your teeth, just like this. Don't mind the different colors. They're made for different options. Once we find the proper position of the jaws and we've built the teeth back up, this is something you wear temporarily all day, 24 hours a day. You can eat with them for about 3 months. And once we've found this proper positioning of the jaw, then we can restore the teeth to this and make it a more permanent solution.